Greetings, I'm Dr. T.K. Jones with Providence Primary Care in Jacksonville, Florida. Welcome to another session of Morning Coffee with Dr. T.K. Today we're going to talk about music therapy. So music therapy is a form of treatment that uses music within the therapeutic relationship to help the patient reach their individualized goals. And this is an evidence-based approach. It's not a fad, in which techniques such as listening to, reflecting on music, and even in some cases creating music are used under the guidance of a trained musical therapist to help meet the needs of their patients. Now, you don't have to have a musical background to benefit from music therapy. In fact, people of all ages, from children to adults, have benefited from this particular therapy. Now, it's used to manage a lot of physical conditions such as pain. It's also used to help treat people who have had cardiac complications, diabetes, cancer, even dementia. And so specifically, it can help with lowering heart rate and blood pressure, reducing stress, improving sleep, and it's known to help boost memory and cognitive function, which is why it's also used to help patients with brain damage. Music has a lot of powerful effects on our psychological and mental health as well. Specifically, it's shown to help lift one's mood. It can help reduce anxiety, alleviate depression, and for some patients, particularly on the autism spectrum, can help them regulate their emotions, especially those difficult emotions. So how exactly does this all work? Well, we have long appreciated the healing and cathartic power of music. Music brings back wonderful memories. The earliest form of music therapy, we would say, is when we learned our ABCs, singing that song. But modern music therapy seems to have began around World War II, when a community of musicians visited troops in the hospital as they were recovering. And so they were shown to have improvement in both their physical and emotional condition. And so eventually this prompted other institutions to hire musicians to provide this service. And so music therapy continues to be practiced in hospitals, but also in nursing homes as well. And so the power that music holds is expansive in terms of the many people that it reaches. If you consider music therapy as a form of treatment for yourself, one helpful approach is to look for someone who is board certified. And once you're able to connect with a therapist, you want to make sure that they're a good fit for you. So you want to ask them questions like, how would you help my particular concern? You want to inquire if they've treated someone with your similar condition. And also you should ask about what they think their treatment course would be, or the timeline for that treatment. So those are some very important questions that I would suggest that you ask the therapist. And finally, I'd like to say that this talk is actually quite timely. On May 18th in Middleburg, Florida, there will be a music therapy session. And if you'd like more information about it, you can visit our website at providencepcjax.com. This event is hosted by Pink Ribbon Symposium, and you can also get information from their site as well. So I hope that this was an informative talk for you and that you will go back and do some research. And if you have any questions, you can always reach out to me through Facebook, through this platform, or also through our website at www.providencepcjax.com. Thank you.